Okay, good morning, everyone. Hello, my name is Kumar. I am the Vice Chair of the ECRF, and a warm welcome to this webinar. So this is a part of the series of webinar run by the Palliative Care Research Network. These are set up as a small group events where the colleagues can share their experience, expertise, and research ideas in a safe, non-threatening, and non-critical environment. So this webinar will be recorded and will be available on the Palliative Professional Hub, maybe after 24 hours, maybe or 2 days. This recording will be shared widely and many people will share. So, and also there is a caption, and so if you want any of the caption, you can do it on the screen, below the screen. Okay, there are some housekeeping and things I want to go over. Okay, please turn off your camera and mute your audio during the presentation for the better effect. And also, rename yourself, if it is not, if you are comfortable, you can rename yourself so that other people can see who you are. And also, there is a dedicated time at the end of the webinar. There's an option for, there is an opportunity for you to have an questions to ask, during the presentation. If you have any questions, please use the chat box to type your questions. And also at the end of the webinar, there is during the Q&A sessions, you can use the hand raising button to ask your questions. My colleague Claire, she will facilitate the Q&A. So thank you, Stephanie, for agreeing to facilitate the webinar. Thank you very much. She is our own ECRF members. Her name is Stephanie Crawford. She is doing the PhD in the School of Psychology, Queen's University, Belfast. Her research expertise is around death literacy, which is under-researched area in Island of Ireland. As part of her PhD, she validates and optimizes the death literacy index in Island of Ireland. Her research will advance our understanding about death, dying, and bereavement, and also her findings will help to assess the outcomes of public health approaches and also inform the policymakers and improve the end-of-life care provisions. Okay, without further ado, I welcome Stephanie to present her webinar. Thank you, Stephanie.
Perfect. Thanks so much. Let's see. There we go. So hello everyone, and warm welcome to my webinar today. So the webinar is Deaf Literacy, what does it mean for Ireland? And that is just the members of the research team there on screen, so special thanks to them. So this is just the agenda of what we're going to go through today. So we're going to begin with talking about, well, what is deaf literacy? Talking about the development of the term deaf literacy, what actually is it, and what makes up deaf literacy. We're then going to move on to deaf literacy and the island of Ireland. So what does the deaf literacy of the island of Ireland look like? We're then going to talk about deaf literacy and the community in terms of the role that a community can play in developing their deaf literacy. We're then going to talk about the Deaf Literacy Index, which is a tool that has been developed to measure deaf literacy. And then we're going to finish today by talking about my research and the implications of my research for the island of Ireland. So to begin today, we're just going to talk about the development of the term deaf literacy. So deaf literacy was developed through the Bringing Our Dying Home research project that was first published in 2011. And the Bringing Our Dying Home research project aimed to investigate the impact that being part of informal care networks can have on your relationships and the impact, and it also aimed to investigate a community development approach to end-of-life care. So a community development approach is where networks of people, such as friends and neighbours, come together to provide end-of-life care. So the researchers had numerous methods to investigate their aims, and this included photo voice, network mapping and focus groups, interviews, and workshops. And they did this with a variety of participants that included primary carers, their support networks, hospice mentors, and professional carers. So the Bring It or Dying Home research project found what they referred to as a process of transformation. So this is where individuals who are providing end of life care for someone undergo a process of experiential learning. So, this process of learning through the experience really developed their individual skills and knowledge surrounding death and dying, and also changed their attitudes towards death and dying, particularly towards things like dying at home. So, the researchers then coined this term, this process of transformation, death literacy. So the concept of deaf literacy was developed further through the Caring at End of Life research project, and this research concluded 6 years of research where they collected 308 narratives surrounding the function and effects of informal caring networks. So the researchers found that individuals who had no previous knowledge or skills towards end of life care were still able to provide end of life care successfully. And the researchers found that individuals were able to do this through processes of learning and help seeking. So deaf literacy was developed through the concept of like health literacy. So health literacy actually emphasizes the role of community engagement in the maintenance and promotion of health. So like health literacy, deaf literacy emphasizes the role of community engagement in end of life care. So therefore, deaf literacy was developed within a public health framework. So this really emphasizes the success of deaf education when it's delivered in equal partnership with communities. So you may be wondering what actually is deaf literacy. So deaf literacy has been defined as the knowledge and skills that people need to make it possible to gain access to, understand, and make informed choices about end of life and death care options. So there are four facets that make up deaf literacy, and the facets of deaf literacy is knowledge, skills, experiential learning, and social action. So, for the facet of knowledge, so this refers to knowledge of available end of life care service networks, knowledge of dying at home public health policies, and knowledge of the end of life care planning process, and also knowledge of things like end of life care medicines and equipment. For the facet of skills, so this refers to having interpersonal and practical skills for providing care, for engaging in body disposal, for communicating effectively with professionals and others about dying and death care options, and also skills to enable connections following a bereavement. And then experiential knowledge. So, this is the knowledge and skills that an individual will gain through direct experiences providing care for someone who's at the end of their life. And then social action is the manner in which individuals will share these knowledge and skills that they have learned through these direct caring experiences with members of their social network. So I just wanted to display, well, what is someone who like has high def literacy? What do they look like? So just in terms of knowledge, so an individual who has a high def literacy will have an increased understanding and knowledge of end of life care service networks, end of life care medicines and equipment, and the end of life planning process. And then towards skills, someone who has a high def literacy will have developed valuable interpersonal and practical skills for providing care and things like communicating about dying and death care options with professional services and others. So in terms of experiential knowledge, individuals who have a high deaf literacy will be able to reflect and make sense of the process of caring as they view death as part of life. They can normalize the home as a place of care and a place for death. They can appreciate social networks. Oh, sorry, it's cut off there on my screen, and understand the collaboration of individuals who are involved in caring at home. Um, Also, in terms of social action, an individual who has a high deaf literacy is better able to share knowledge and skills with other communities, and they are equipped for future care, and they are better equipped to prepare their own end of life care plan. So, as I mentioned briefly before, deaf literacy is actually based on a public health framework. So, a public health framework is an approach that has really re-emerged over the last few decades, that places greater focus on the social aspects of death and dying, and also the role that a community can play in providing holistic care to its community members. So it's this cultural and this community engagement that will really create a cultural change that is effective and sustainable. So in recent years, there has been an increased drive for the implementation of public health approaches, and this is with the aging population. So it's well known that an aging population has increased the demand on palliative care and end of life care services. And there's also an increased frequency of the number of individuals who would like the home to be the place of end of life care and a place for death. However, this is far from the reality for many people. Um, so the community engagement that is promoted through a public health framework will mean that healthcare services are designed with community needs in mind, and also then as a result, community members are more likely to be able to access these services and utilize them. Um, so an example of a public health approach, which you may have heard of before, is that of compassionate communities. So compassionate communities aim to normalise deaf, dying, and grieving through deaf literacy, whilst building sustainable and network building caring capacity to promote equity and access to end of life care. So, compassionate communities aim to increase our knowledge and skills towards death and dying, so our death literacy. And the hope is that by improving individuals' levels of death literacy, we will empower communities to take charge of their own end of life care, and also give them the tools to plan effectively for their own end of life care, and consequently get the death that they deserve and the death that they want. And compassionate communities are actually being implemented across Northern Ireland and the Republic of Ireland. So this is just a wee slide here that I want to show you that shows some of the public health approaches that have been implemented in Northern Ireland and the Republic of Ireland. So I'm just going to talk about a few of them. So just down the bottom right-hand corner there, so the HSC palliative care policy. So this is policy that's been implemented in the Republic of Ireland since 2001. And this policy re-emphasises the importance of specialist palliative care services across the Republic of Ireland. It also provides a protected budget for these services, and it has numerous implementation aims, such as providing 8 to 10 specialist palliative care beds per 100,000 of the population. And then if we look in the top left-hand corner there, so the palliative care in partnership program is a more common known approach in Northern Ireland. So this program actually has numerous aims, and just to name a couple, so this program actually aims to provide adults in Northern Ireland who have a palliative care need with a palliative care key worker. And it also aims to engage in advanced care planning. And then, of course, we have our Compassionate Communities programs. So the Compassionate Communities Northwest program actually has a Compassionate Community Charter, which has death, dying, loss, and care policies and documents that have been implemented across schools, workplaces, and hospices in Northern Ireland. So, despite our efforts to implement these public health approaches and improve our level of deaf literacy across Northern Ireland and the Republic of Ireland, the success of our efforts is relatively uncertain, because no such measure to actually assess the outcome of these public health approaches has been substantially validated and accepted. And this is actually something that the Deaf Literacy Index claims to do, which I will discuss in later slides. So you may be wondering at this stage, well, is the island of Ireland deaf literate? So there's actually a bit of research on the attitudes, beliefs, knowledge, and skills of Northern Ireland and the Republic of Ireland towards death and dying and palliative care. And we can actually look at this research to get an inside look into, well, what does our deaf literacy look like? So if you look at McIlpatrick's study in 2013, so McIlpatrick study really shown that there was a stigma in Northern Ireland towards death and dying. So the study found that whilst individuals in Northern Ireland do recognise the importance of talking about death and dying, they just simply don't want to have these conversations. So the researchers actually found that the reasons behind not wanting to have these conversations was actually due to a sense of fear. So individuals feared that having such conversations has the potential to cause upset and distress to their friends and family members. So they would rather avoid having the conversations at all. And then interestingly, McIlpatrick conducted a more recent study in 2021. And despite this research being conducted almost 10 years later, the research actually showed little change in the attitudes of Northern Ireland towards death and dying. So the research in 2021 found a lack of public knowledge in Northern Ireland towards palliative care and advanced care planning. So the researchers found that only 1 in 5 individuals in Northern Ireland were able to accurately define what palliative care actually is. And further to this, 60% of the sample stated that they did not want to increase their palliative care knowledge further than its current state, despite the researchers showing that this was quite poor. The research also shows that the Republic of Ireland also has room to improve their deaf literacy also. So a national survey was conducted for the Irish Hospice Foundation in 2014. And this study showed that only 1/3 of the sample believed conversations around death and dying and bereavement in the Republic of Ireland were sufficient. Um, but a more positive finding from this study was that it showed individuals in the Republic of Ireland were more open to having conversations around death and dying. So this is potentially conflicting to that of McIlpatrick's research, and potentially could highlight a cultural difference here between Northern Ireland and Republic of Ireland in terms of deaf literacy and their attitudes towards death and dying. And then finally, a report that was published by Marie Curie in 2022 discussed the findings of a national survey, which found that 1 in 4 individuals in Northern Ireland were uncomfortable or very uncomfortable talking about death and dying with friends and family members. So this was actually 5% above the average for the UK. So as you can see, the research really does show that there are improvements to be made in Northern Ireland and the Republic of Ireland in terms of deaf literacy. Here we go. So I just want to move on to talking about the Deaf Literacy Index. So after the researchers in Australia developed the concept of deaf literacy, they then were faced with the question, well, how do we actually measure this thing of deaf literacy? So they created the Deaf Literacy Index to do that. So the Deaf Literacy Index is a 29-item measure, and I'm just going to take you through it so you can see exactly what's in the Deaf Literacy Index. So this is the first section of the Deaf Literacy Index of practical knowledge, and practical knowledge is actually divided into talk and support and doing hands-on care. So practical knowledge assesses what individuals believe that they are able to talk about death, dying, on loss to their friends and family, and how able they believe they are to engage in hands-on care with someone who is at the end of their life. So for this first section of talk and support, so it asks individuals to rate how able they believe they are to talk about death, dying, or grieving to a close friend, talk about death, dying, or grieving to a child, talk to a newly bereaved person about their loss, and talk to a GP about support at home or in their place of care for a dying person. And then the following section of doing hands-on care asks individuals to rate how able they are to undertake the following care duties for the dying in terms of feeding a person or assisting them to eat, bathing a person, lifting a person or assisting to transfer them, and administering injections. So this is the next section in the Deaf Literacy Index of experiential knowledge. So this has 5 items in it that assess the wisdom and knowledge that individuals gain from direct experiences providing care for someone who is at the end of their life or through death education. So it asks individuals to rate how much each of these statements are very true or very untrue of them. So it asks you to rate how your previous experience of grief, loss, or other significant life events have increased your emotional strength to help others or with death and dying processes, have led you to reevaluate what is important and not important in life, has developed your wisdom and understanding, and has made you more compassionate towards yourself and provided you with skills and strategies when facing similar challenges in the future. So the Deaf Literacy Index also has a section on factual knowledge. So this really assesses an individual's knowledge of the deaf system in terms of what information they know that is needed to plan well for caregiving, death, and dying. So this section asks individuals to rate how much they agree that they know the law regarding dying at home, that they feel confident in knowing what documents they need to complete in planning for death, that they know how to navigate the healthcare system to support a dying person to receive care, that they know how to navigate funeral services and options, that they know how to access palliative care in their area, and that they have sufficient understanding of illness trajectories to make informed decisions around medical treatments available and how that will shape quality of end of life, and that they know about the contribution the cemetery staff can make at end of life. And then this is the final section of the Deaf Literacy Index of community knowledge. So like the first section, community knowledge is divided into others can help me provide end-of-life care and support groups in my community. So community knowledge assesses what individuals know about the services and end-of-life and grief supports that are available in their community. So for the section of others can help me provide end-of-life care, it asks someone to consider if they were to provide end-of-life care for someone that they know people who could help them, access community support, provide day-to-day care for the dying person, that they know people who could help them, access equipment required for care, access culturally appropriate support, and access emotional support for themselves. And then the final section of support groups in the community asks individuals to rate how much they agree that there are support groups in their community for people with life-threatening illnesses, people who are dying, carers for people who are dying, and for people who are grieving. Okay, so we're just going to now move on to my research. So I'm currently undertaking a PhD within the School of Psychology at Queen's University Belfast. And for my research, I'm really interested in understanding the deaf literacy of the island of Ireland and investigating it more and really understanding, well, what can we do to improve our levels of deaf literacy? So these are objectives for my PhD. I aim to validate and optimize the Deaf Literacy Index for use in an all-Ireland population. I aim to provide population-level benchmarks of deaf literacy. I aim to develop an understanding of the predictors of deaf literacy, and I aim to co-produce recommendations on how deaf literacy can be addressed for communities in the island of Ireland. So I aim to meet these objectives through conducting 3 research studies throughout my PhD. So just to begin by talking about my first research study. So I'm going to talk about just the research I've done to date. So the Deaf Literacy Index was actually developed as a tool that was to be generalizable. So a tool that can be used in other countries other than Australia. So research has been conducted that has investigated the use of the Deaf Literacy Index in other countries, such as the United Kingdom, Sweden, China, and Turkey. So for my first study, I was really interested in, well, can we use the Deaf Literacy Index for the island of Ireland? So the aim for my first study is to optimize and validate the deaf literacy index in an all-Ireland population. So to do this, I gathered a sample of 20 research participants, and I was lucky enough that I actually got quite a good response to my first study, and I was able to do stratified sampling. So this was to ensure that the sample was representative of the population of Northern Ireland and the Republic of Ireland. So therefore, half my sample was residents of Northern Ireland and half are residents from Northern Ireland. Also, half my sample were healthcare professionals and members of the general public, and this also is very useful to see if there was any differences in deaf literacy, as would be expected between the two samples. So to investigate my aim, I asked participants to engage in a cognitive interview. So this interview is conducted online on Microsoft Teams, and I actually asked individuals to think aloud. So thinking aloud is literally just saying aloud any thoughts or feelings you have whilst you complete a task. So in this case, I asked participants to think aloud, say aloud any thoughts or feelings they had whilst they were completing the Deaf Literacy Index. So for the interviews, I asked participants to complete the Deaf Literacy Index twice. So the first time they completed the Deaf Literacy Index, I asked them just to complete it as if they were completing it for themselves. And this was so participants could get really familiar with what was in the Deaf Literacy Index, and also so I could investigate any initial issues that arose with the Deaf Literacy Index at first sight. Um, I then asked participants to complete the Deaf Literacy Index a second time. And during the second time, they did not rate it for themselves. They instead they used a thing called a content validity index. So, a content validity index is simply just a scale from 1 to 4 that ranges in terms of relevance, 1 being not relevant and 4 being highly relevant. So what participants did was they went through the Deaf Literacy Index again, using this scale from 1 to 4, and they provided a rating for each item within the Deaf Literacy Index in terms of how relevant they thought it was to be included in the Deaf Literacy Index. So as it was online, all the interviews were recorded and the interviews were transcribed. And that is just actually a research poster as well on screen there that I made and presented at a couple of conferences. Um, let's see. Okay, so for my data analysis, my data analysis was informed by the Cosman criteria for good content validity. So the Cosman criteria for good content validity is just a set of guidelines that I use that could tell me, is the Deaf Literacy Index, does it measure what it's supposed to measure, and is everything in it that is supposed to be in it? So the Cosman criteria are actually divided into that of relevance, comprehensibility, and comprehensiveness. So therefore, I could use these criteria and see, well, is the Deaf Literacy Index relevant? Does everything in it make sense? And is everything in it that is supposed to be in it? So really for my data analysis, what I wanted to do was I wanted to identify any issues that were present in the original Deaf Literacy Index for our sample. So to do this, I went through and identified issues that participants experienced for their first completion of the Deaf Literacy Index. So this was when they completed the Deaf Literacy Index for themselves. I then also identified issues participants experienced for their second completion of the Deaf Literacy Index, and this is when they used the Content Validity Index, so the scale 1 to 4 in terms of relevancy. So I identified the issues according to the Cosman criteria. So I identified issues of relevance, issues of comprehensibility, and issues of comprehensiveness. And I must say at this stage, it was really key that I used the Think Aloud methodology. This was really key to understanding what the actual problems were, and especially for identifying issues of comprehensibility, because people would say aloud their thoughts behind their rating for the scores, and they would read aloud the actual items. So therefore, I could actually see whether they had misinterpreted what each item was in the Deaf Literacy Index, which is actually something that I could not have done if I didn't use the Think Aloud methodology. I then also identified issues that were highlighted through the use of the Content Validity Index. So this is where they rated it from 1 to 4. So this added like a layer of like quantitative data just to identify the issues, and this really allowed me, so I used the content validity index to conduct calculations. So I conducted two calculations. So the first thing I calculated was something called an item level content validity index. So this is just something that told me, well, is every item in the deaf literacy index relevant? How relevant is each item? I then calculated something called the overall scale content validity index, which could tell me, is the deaf literacy index relevant as a whole measure and also as each individual section. So the sections of practical knowledge, experiential knowledge, community knowledge, seeing whether they are relevant as a section. And then I also, at the end, conducted reflexive thematic analysis. So I did this because I had such a rich quality of qualitative data that I gathered with my Think Aloud method, that I didn't want this data to go to waste, and I wanted to ensure that I'm fully exploring any latent data and just explored the data as much as I could. So I conducted reflexive thematic analysis both deductively and inductively. So I used the Cosman criteria as sort of a guide for this. So I used like a framework of relevance, comprehensibility, and comprehensiveness. And I must also say, using the Cosman criteria was really helpful for my data analysis because it made sure that my data was structured. Everything was organized into these three headings, and it really helped me understand the data better, know what I'm doing, and see, well, potentially how could we remedy these problems. So after I analysed the data, I conducted panel meetings. So I actually conducted two panel meetings, and the purpose of the panel meetings was to discuss the issues of concern that I had identified in the data analysis, and to also discuss these issues and hopefully create any amendments that we needed to make to the original Deaf Literacy Index. So the panel meetings lasted approximately 2 hours in length. And the individuals who attended the panel meetings was research supervision team members and PPI members, and also Dr. Kerry Noonan, who is actually one of the original Deaf Literacy Index authors from Australia. So it was very, very useful to have her attend one of these meetings because it enabled us to identify whether we were interpreting each item in the Deaf Literacy Index correctly, and it gave us the opportunity to ask her any questions surrounding why such items were included in the Deaf Literacy Index. So I'm at the stage now where I have conducted these panel meetings and I have created a new Deaf Literacy Index. So that is it, just on the bottom of the screen there, what it's called. So it's called the Deaf Literacy Index Island of Ireland, and its abbreviation is DLI-IRE. So unfortunately, I'm unable to share this new Deaf Literacy Index with you today. And this is because I'm currently seeking ethical approval to retest this new Deaf Literacy Index. So this is really just to add another layer of rigor into my study and like final check. So what I aim to do is use this new Deaf Literacy Index and administer it on Qualtrics via a survey online. So the sample that I want to get achieve for this is similar to my first stage. So 20 participants, half healthcare professionals, half members of the general public, half residents of Northern Ireland, and half residents of the Republic of Ireland. But this time I'm not going to ask them to complete the Deaf Literacy Index for themselves. I'm going to use a similar step to my first stage, where they use the Content Validity Index for a scale of 1 to 4 and rated it in terms of how relevant everything was. So I'm going to expand upon this in terms of the Cosman guidelines, and I'm just going to ask participants to complete this new Deaf Literacy Index and provide a score from 1 to 4 in terms of how relevant it is. Does everything make sense in it? So comprehensibility and comprehensiveness, is everything included in it that is supposed to? And then this will finalize the new Deaf Literacy Index, and I can move on to my second research study, which is a benchmark study. So thank you as well for, if you've got to the end here, so the of the webinars, this will wrap up today. So I'm just going to finish today with talking about the implications of my research for the island of Ireland. So the first implication is that my research will increase the understanding of individual experiences, beliefs, knowledge, and skills of deaf, dying, and bereavement. And this is because the Deaf Literacy Index is a really useful tool to have. It not only can be used quantitatively, so you don't have to just use it as a quantitative tool in questionnaires. You can use it as a qualitative tool to really explore more in depth the deaf literacy of a sample. It can be used as a conversation starting point. It can be used in focus groups, and it could be even used as like an interview schedule. So although I haven't used it in this manner, when I was conducting my interviews, I really seen how much individuals go into depth of talking about their experiences, their beliefs, their knowledge and skills, when they're um, thinking about what rating to give every item. And this is something that really is quite unique for the Deaf Literacy Index. Um, my study can also better inform policymakers and end of life service provision on the island of Ireland. So I touched on this briefly earlier, and this is that the Deaf Literacy Index aims to be able to assess the outcome of public health approaches. And how it will do this is you can administer the Deaf Literacy Index at the first step, and you'll get a baseline level of deaf literacy. Then you could implement a public health approach, such as a compassionate communities aiming to improve deaf literacy. And then after this approach, you can administer the deaf literacy again and see, well, has this approach improved our levels of deaf literacy? And this can be really key for future use, because this could mean that we can assess how effective is the public health approaches that we're currently using, seeing what ones are effective, what ones aren't. And then we can identify communities that have low levels of deaf literacy and implement these successful public health approaches to these communities. Another implication is that my research will enable comparisons of deaf literacy to be made across communities or at a national level. So my second research study is a benchmark study, and this is where I plan to administer the Deaf Literacy Index to a large sample across Northern Ireland and the Republic of Ireland. And individuals will just complete the Deaf Literacy Index for themselves. So I will calculate a benchmark scores of deaf literacy, so just average scores of deaf literacy for Northern Ireland, Republic of Ireland, and the island of Ireland as whole. And this is just so because I want to make this research as useful as possible for the future and as easy as possible. So this means that individual communities will be able to complete a deaf literacy index and compare their scores across a benchmark level and see how they sit in comparison. It also means that communities will be able to compare their deaf literacy scores across each other and or nationally. So you can compare Northern Ireland's level of deaf literacy against Republic of Ireland or international countries such as UK, Sweden, China, and Turkey. And the final implication is that communities will be better informed and supported to improve their deaf literacy. So this is something that the study will mainly address. And the Deaf Literacy Index for the benchmark study, I'm not going to just provide a benchmark score for the whole Deaf Literacy Index itself. I'm also going to provide benchmark scores for each section within the Deaf Literacy Index. And this means that communities, when they take the Deaf Literacy Index, they'll be able to actually identify what areas of deaf literacy they could improve upon. So this means that they'll be able to identify, oh, it's practical knowledge needs improved. They can target these services to improve these levels of deaf literacy. And my final study is that I aim to do a Delphi study with healthcare professionals, where we will co-produce recommendations to address deaf literacy across communities. So it'll be quite interesting to see the results of this study and hopefully create a good set of recommendations that communities can use. So we will give them the tools to better improve their deaf literacy. And that's me today. So thank you very much for listening, and I really encourage anyone who has any questions to ask away. Thank you.
So that was excellent, Stephanie. Thank you so much.
Thank you, Stephanie.
Yeah, I think as well, I just wanted to give a comment that, you know, I know in my own experience working in palliative care and trying to support people looking after loved ones, you know, at end of life and in the community, it often is, it's almost overwhelming for people to try and take on so much information at that time when everything is so emotional, even simple things about logistics around care, that I think it's such a worthwhile project to try and improve that death literacy in general for that. If anyone has any questions, please put them in the chat,